this is usually seen in young children, like 9 months, when they are able to crawl around and they may see some object and they may put it in their mouth and choke on it. So it's more common amongst the older infants and up to about 5 years. But of course, foreign body aspiration can happen at any age. There's a history of choking, gagging, or sudden coughing, but many a times it can go unwitnessed because you can't be looking at the child all the time. So it doesn't mean that if nobody witnessed, the child didn't aspirate. Contributing factors in young children is the fact that they don't chew well because of lack of molar teeth in the young. The tendency to talk, laugh, or run with food in the mouth, and of course the tendency to put any item in the mouth. So they present, the signs and symptoms of foreign body inhalation will vary depending upon the site of infection and the degree of blockage and the type of object. At the larynx or the voice box and trachea, total block can result in death. Partial block results in stridor, hoarse voice, and breathlessness. At the bronchus, usually it can drop into the right bronchus because it's more vertical than the left, and it can present as a recurrent or persistent cough, wheezing, or even pneumonia. Lithium-containing button batteries are very dangerous. You can see all the common foreign bodies that cause this problem, either swallowing or choking on a coin, magnet balls, even food like fish ball, peanuts, raisins, and button batteries. So the thing about button batteries is when it is in contact with the saliva in the mouth, it can cause alkalizing reaction and it can cause erosion of tissue. So if it's stuck somewhere in the throat, it can actually cause a lot of tissue damage. This is one which requires urgent medical attention, and especially so if there is a sudden onset of noisy breathing. X-ray neck and chest will show metallic objects, but not plastic or wood, so it may not be seen. Management would need a laryngoscopy or a bronchoscopy under anesthesia if it is in the bronchus and for accessible items. I've seen a boy, 7 years old, who presented with a history of having frequent runny nose and block and having repeated courses of antibiotics to clear the mucus, and he did get better, but it recurred. So when I saw the history was a bit suspicious. So as I was examining and looking at his nostril, and then I couldn't see anything very much, so I told him to blow his nose, and then after that I took a good look, and I actually saw something blue, which was rather strange. So I asked him if he had put anything in the nose. The boy denied and said no. So anyway, I suspected it was a foreign body and sent him to the ENT. And of course, what they found was a blue tip of a ballpoint pen. And when he was asked about it, he said that he used to strangely stick up the end of the ballpoint into his nostril. I don't know what the reason was, whether he was having an itchy nose. But then as he was twisting it around, it got stuck inside. He tried to blow it out, it couldn't come out, and then he was too scared to inform his parents.